Well, a top health expert says that Americans will probably be wearing face masks for a very long time. A senior scholar at Johns Hopkins Center for Health Security saying, quote, "I think that mask wearing and some degree of social distancing we'll be living with, hopefully living with happily, for several years." Dr. Marc Siegel, professor of medicine at NYU Langone Medical Center, Fox News contributor, joins us now. Dr. Siegel, several years? I mean, the Spanish flu in 1918, that pandemic lasted 2 years. Do you see us wearing masks for that long?
Actually, I don't think we'll be wearing masks for that long for a number of reasons, Eric. First of all, we're hoping to get a vaccine, which would help a lot with COVID-19, obviously. That would bring us, hopefully, up to a level of herd immunity, which, given how contagious this virus is over 50% of the people here in the United States being infected or getting a vaccine. But the real issue here is, what's the value of masks? And I think masks work. I think that they're valuable. I wear one myself. Obviously, I wear one as a physician, but I wear it in public. I think it adds something. But I think the key, I think he has it reversed. I think it's the physical distancing that really gives us what we need. Because if you're standing, and we use 6 feet, but it's probably farther than that, 6 or more feet apart, you can't catch the virus by somebody coughing or sneezing who doesn't know they have it. The mask protects you from a wearer who is infected and doesn't know it or is coughing, but we don't actually have the studies to prove how effective it is. So I call the mask the icing on the physical distancing cake. So I think he has it reversed. Yeah, I mean, and by the way, if we're wearing a mask, it can't be dirty. It can't be dirty. You know, it can't be dirty. You've got to change it. Yeah. You got to wear it.
I was going to say that, you know, there have been some studies. It's not just sneezing or coughing. It's just breathing. It's talking. It's speaking. It's singing. And that the aerosolization of this can just stay in the air. So if you wear a mask, that helps protect you. So what do you say, doctor, to those people who say, no, I'm not going to wear a mask? You know, 4 states, Montana, South Dakota, Iowa, Wisconsin, they don't have statewide mandate requirements. So what do you say to those folks who still push back against wearing a mask?
Eric, I'm all for a mask, again, but the mask protects the other people from you if you happen to have it. It's a barrier, and I say to them, you should wear it. Government mandates are fine, but people should do it out of a sense of personal responsibility. Social distancing first, mask second. The mask is not perfect, but it adds something. You could have it and not know it. You could be pre-symptomatic and you're about to get it a few days from now and not know it. Everyone should be wearing them right now, and especially in hot spots.
All right, there's the advice from Dr. Siegel. Meanwhile, talking about hot spots, you got school coming up. You know, what are we going to do about that? Here's Governor Andrew Cuomo talking about some of the concerns.
We obviously very much would like to. Nobody even knows the effect that this is going to have on students, socialization of young students, et cetera. We want kids back in school for a number of reasons, but we're not going to say children should go back to school until we know it's safe.
Doctor, what's your advice to parents?
Well, first of all, Eric, I think we have to start with, are we dealing with a hot spot or not? New York City is doing really well right now, and we've really batted this down. There's less than 500 new cases in the whole state of New York over the last 24 hours. So I think New York absolutely should be looking at reopening schools because, as we know, the death rate among very young people is extremely low, less than 4% for people under the age of 44. So the kids, even if they get it, get very mild cases. And we can teach our kids about physical distancing, about wearing masks, about hygiene, about washing their hands and using sanitizer. The other issue here, though, is teachers. And here's what I want to say about teachers. And no one has said this before. Eric, as a doctor, I'm on the front lines. And I have my patients. Waiters are on the front lines in restaurants. I want teachers to be asked. Teachers are on the front lines. They're going to want to teach. You need to be in person to really teach. I say reopen the schools.
Yep. All right, Dr. Siegel, up against the clock. Thank you.